Dear students, welcome to my YouTube channel, Indian Anatomist. Today I am going to discuss the gross and clinical anatomy of the rotator cuff muscles. Now, what are rotator cuff muscles? The rotator cuff is a group of 4 muscles and their tendons, provide stability and movement of the shoulder joint. What are those muscles? They are supraspinatus muscle, infraspinatus muscle, teres minor muscle, and finally, number 4 is the subscapularis muscle. Now, why are those muscles called rotator cuff muscles? The cuff of muscles and their tendons helps the shoulder and arm to rotate. It also holds the bones in the shoulder together, and helps to move the arms and lift them overhead. Here's a detailed overview of its anatomy and clinical relevance. The first muscle is supraspinatus muscle. It is an intrinsic muscle of the shoulder joint. Dear students, please see the illustration given for your reference. It originates from the supraspinous fossa of the dorsal surface of the scapula and is inserted into the superior facet present on the greater tubercle of the humerus bone. The nerve supply to this muscle is from the suprascapular nerve, which branches from the upper trunk of the brachial plexus. Its main action is as follows: it initiates and assists in the abduction of the arm from 0 to 15 degrees. Next is infraspinatus muscle. It is a triangular-shaped intrinsic muscle of the shoulder region. It originates from the infraspinatus fossa of the dorsal surface of the scapula. It runs laterally, and is inserted into the middle facet of the greater tubercle of the humerus bone, just inferior to the insertion of the supraspinatus muscle. The nerve supply is from the suprascapular nerve. The action of this muscle is lateral rotation and extension of the shoulder joint. In addition, it also abducts the inferior angle of the scapula when the arm is fixed. The next muscle is teres minor muscle. Like the other two muscles, this is also an intrinsic muscle of the shoulder region, but it is narrower than the previous muscles. It originates from the upper 2/3 of the lateral border of the posterior surface of the scapula. This muscle is inserted into the inferior facet present on the posterior surface of the greater tubercle of the humerus bone, just inferior to the insertion of the infraspinatus muscle. The nerve supply to this muscle comes from the axillary nerve. Now coming to the action of the teres minor muscle. Along with the infraspinatus muscles, this muscle produces lateral or external rotation, adduction, and extension of the shoulder joint. Finally, subscapularis muscle. Among the rotator cuff muscles, the subscapularis is a large and powerful muscle that helps with shoulder movement and joint stability. It originates from the subscapular fossa or anterior surface of the scapula. It runs laterally and is inserted into the lesser tubercle of the humerus bone. The subscapularis muscle is innervated by both upper and lower subscapular nerve from the posterior cord of the brachial plexus. Now come to the action of subscapularis muscle. It is responsible for the medial or internal rotation of the shoulder joint, and stabilizes the humeral head in the glenoid cavity. Dear students, please watch the video for better understanding. For our convenience, the humerus is erased from the shoulder joint. Now it is clear that the rotator cuff muscles are coming from the anterior, superior, and posterior aspects of the shoulder joint. The tendons of these muscles reinforce or support the fibrous capsule of the shoulder joint. In this video, please see how the other muscles are protecting the rotator cuff muscles. Dear students, have you heard the term musculotendinous cuff? Yes. No doubt. The rotator cuff is also known as the musculotendinous cuff, because these 4 muscles forms the protective cuff that surrounds the humerus head and keeps it in the shallow glenoid cavity of the scapula. The shoulder joints, abduction, lateral rotation, and elevation are made possible by this stabilization. The next part is the blood supply to the rotator cuff muscles. Please see the illustration side by side. The rotator cuff muscle receives blood supply from branches of the suprascapular artery, from the subclavian artery, and circumflex scapula, subscapular arteries from the axillary artery. Dear medicos, now it is time to discuss the clinical anatomy of rotator cuff muscles. Number 1 is rotator cuff injuries or tear, the tear may be partial or complete. Often, it is caused by repetitive stress, degenerative or traumatic changes. Most commonly, the supraspinatus is affected. What may be the symptoms and diagnosis of rotator cuff tear? The symptoms are pain, due to the overhead activities, limited range of movements, and weakness. The clinical examination, MRI, and ultrasound are the principal diagnosis for the rotator cuff tears. Number 2 is rotator cuff tendinitis. It is caused by overuse leading to inflammation of the tendons. This is common in athletes and individuals performing repetitive shoulder movements. The third one is rotator cuff impingement syndrome. In this, the tendons are compressed during shoulder movement, leading to pain and inflammation, and frequently associated with subacromial bursitis. Finally, the fourth one is management and treatment for rotator cuff injuries. Conservative treatment for rotator cuff injury is taking rest. It is followed by physical therapy or administering the anti-inflammatory medications, especially NSAIDs, and corticosteroid injections. The surgical treatment for rotator cuff injury may involve tendon repair or decompression procedures, especially in cases of significant tears, or failure of conservative treatment. Dear students, the rotator cuff muscle topic is completed. If you have any doubts, please put them in the comment box. Don't forget to like, share, and subscribe to my YouTube channel, Indian Anatomists. Please click, or touch, or enable the bell button, to get the notifications of new videos. Thanks for watching. Good day all.